Hi everyone, my name is Obiena and this is Health Vault, where we jump into the fundamental topics about health and wellness. Today, I am joined by our doctors.
Hello everyone, I am Dr. Erman Fadialan, a neurologist at Our Lady of Lourdes Hospital.
And I'm Dr. Cesar Co, a radiologist at Our Lady of Lourdes Hospital.
Our topic is about aneurysm, the silent time bomb in your brain. So Doc, could you tell us about what exactly is aneurysm?
An aneurysm is an outpouching or dilatation in the part of a blood vessel where there is weakening of the walls. So sometimes we call it as a balloon-like appearance in CT scans or MRIs.
I see. So what are the risk factors associated with the development of an aneurysm? And what are the symptoms as well?
There are certain risk factors associated with aneurysm. Number one is chronic hypertension. Because of the pressure that the blood pressure exerts on the walls, it actually produces the outpouching or the balloon-like appearance. Other risk factors are smoking, which weakens the wall, alcohol consumption, especially if it's heavy. So there's a chance that the blood pressure also increases with increased alcohol, and also there's a genetic predisposition. Most of the time they're asymptomatic, but when they rupture, they produce a sudden onset of an acute headache, excruciating, yung pinakamasakit na sakit ng ulo that you will experience in your life. Aside from that, aside from headache, patients may have vomiting, may have decrease in sensorium, natutulog. Sometimes they produce seizures or convulsions. There are gold standards in the treatment of aneurysms, and both of them are accepted, effective, and efficacious. Number one would be clipping of the aneurysm. So if there is a balloon-like appearance, they would put a clip on the base of the aneurysm so that the aneurysm would have no blood flow, so it will collapse. That's the surgical treatment of aneurysm. The next treatment would be somehow less invasive. We call it coiling of the aneurysm. So if this is the balloon, you put coils inside through an angiographic procedure, and then the coils will fill up the aneurysm and the aneurysm will collapse.
So if I understand correct, aneurysm doesn't just happen in your head, it happens all over the body?
Yes, you can have aneurysms. We have blood vessels all over the body, so you can have aneurysms not only in the cerebral or in the brain, but you can also have it in the other parts of your body.
You go to the MRI to know, and what exactly does MRI do?
Okay, MRI is an acronym for magnetic resonance imaging. So, as the name it implies, we use a big magnet. No, it's what we have here is a 1.5 Tesla. Just to give a comparison, the magnet on your refrigerator is 0.01 Tesla. No, as against the imaging we use, which is 1.5 Tesla. So the patient is put inside the magnetic resonance imaging machine, and the magnet is put on and around the patient, and our body is composed of a lot of atoms. So the atoms realign itself, and the magnet is put off, and our atoms put off a signal. So the signal is picked up by the detector inside the machine, and it is converted by the computer into images. So that's what is magnetic resonance imaging, and it's a non-ionizing radiation, meaning you don't receive any radiation from the machine.
Which is very good. When is MRI recommended in line of aneurysm po?
Aneurysm could be asymptomatic. So the time that we see these cases will be when the patient develops severe headache. No? And MRI is very sensitive in picking up the small bleed around the brain. Basically, it could be a screening procedure. We have what we call the magnetic resonance angiography. So if you have if you are in the high risk group, or if you have genetic predisposition, we could do an initial screening procedure using the MRA, magnetic resonance imaging, magnetic resonance angiography of the MRI.
As an athlete, I do get quite a few MRI scans, and usually it's either I'm feeling some kind of pain in specific regions. Could you expound on that, Doc?
Yes, so magnetic resonance imaging, we could scan from head to toe. There's a lot of application in the neuro side, especially stroke, because we can pick up stroke as early as 6 hours. Whereas in the other imaging modality, the CT scan, in 6 hours time, there might be no findings at all, unless it is a bleed. Okay. No? So for athlete, it's a very useful application, and injury is picked up very well by MRI.
And then I would like to take this point and this opportunity to advertise also that at Our Lady of Lourdes Hospital, we also have other neurodiagnostic tests like your EEG, your electroencephalography, which we use to diagnose patients with epilepsy, patients with headaches. We use EEG. And for patients with spinal cord, muscle, nerve problem, we can also use your EMG-NCV or your electromyogram nerve conduction velocity test.
Okay, for the Department of Radiology, we are open 24/7. So which means if you have an emergency, we will be able to take care of you. We have a regular office hour, which we do for the elective cases, but we have complement of CT scan and MRI. Your doctor will decide which of the imaging modality is the best case for you. One problem with MRI will be if you have claustrophobia, so you will need to go to CT scan for that. No? But I would like to emphasize we are open 24/7 to scan whatever our patient has.
And that it is for today's discussion. Don't forget to like, share, and follow Lourdes Hospital on all their socials and their latest updates and posts. And if you have any question about your health, feel free to leave us a comment down below. Doc, thank you so much. Thank you.